Hemorrhoids. They're embarrassing, uncomfortable, and quite literally, pain in the butt. It's estimated that about 75% of people will experience hemorrhoids in their lifetime, so don't worry, you're not the only one. In today's video, we're going to go through what hemorrhoids are, the causes, tips to prevent them, and the treatments. Let's get to it. So hemorrhoids are swollen veins located in the lower rectum or the anus. They can cause itching, discomfort, and even bleeding during bowel movements. Now there are 3 types of hemorrhoids. First, we've got the internal hemorrhoids. These are located inside the rectum and you won't usually feel pain, but they can cause bleeding. Second is the prolapsed hemorrhoids. These also start inside the rectum but tend to hang out of the body through the anal opening. Often it's during a bowel movement where they protrude past the anal opening. Sometimes they can go back in by themselves, but sometimes they'll need a little help by you pushing it back in. Number 3 is external hemorrhoids. These are usually found as hard lumps around the anal area. They can sometimes cause bleeding, but are often quite painful. The good news is that most of them can be treated at home without medical intervention. So what are the causes of hemorrhoids? There are blood vessels and veins in and around the rectum and the anus. When these blood vessels swell, that's when we get hemorrhoids. They're usually caused by increased pressure due to a number of factors such as pregnancy, being overweight, straining from lifting, or straining from bowel movements. Getting older is also a factor as the tissues in and around the rectum and anus tend to weaken as we get older. So how do you diagnose hemorrhoids? It's hard to diagnose hemorrhoids just based on the symptoms, so you should see a doctor who can do a physical examination to confirm the diagnosis. Let's go through some non-medicated treatments you can try. A gentle option is to use a sitz bath if you have hemorrhoids. This is basically when you just soak your bottom area in a warm, shallow bath. You can purchase specific small bath containers or you can just sit in a tub. It's best to sit for 10 to 30 minutes and repeat this multiple times a day. This can help to improve circulation in the area and reduce swelling and pain. If you're experiencing a lot of pain, you might also benefit from using a hemorrhoid cushion, which is like a round donut-shaped cushion. This will take the pressure off the hemorrhoids when you're in a sitting position. Now let's go through the medical treatments for hemorrhoids. Treatments can be broken down into suppositories and creams. Both of these can be used for internal hemorrhoids and the creams can also be used for external hemorrhoids. A suppository is like a soft tablet which you insert into the rectum and it melts when it goes inside the body. The main types of ingredients you'll find in the over-the-counter suppositories and creams include corticosteroids, local anesthetics, astringents, and antiseptics. Let's go through them one by one. Corticosteroids such as hydrocortisone can help to reduce the size of the hemorrhoids by reducing inflammation and swelling. They also help to reduce the itchiness associated with the inflammation. Local anesthetics such as cinchocaine and lidocaine can help to numb the area so you get immediate relief from the pain and itchiness. Astringents such as zinc oxide and witch hazel work by constricting the blood vessels, which can help to reduce swelling, inflammation, and even bleeding associated with the hemorrhoids. Some hemorrhoid products also contain an antiseptic to help prevent infection. Most products have a combination of a few ingredients. Here are some of the combinations you will find: a corticosteroid plus an anesthetic plus an astringent plus an antiseptic. In addition to the topical treatments, if you have constipation associated with hemorrhoids, it's really important to treat this too. You can watch my video here on constipation. Now let's go through some tips to prevent hemorrhoids. Here are 10 tips to prevent hemorrhoids. Prevention is always better than treatment. Tip number 1, maintain a high fibre diet. Consume plenty of fruits, vegetables, whole grains and legumes. Aim for at least 25 to 30 grams of fibre a day. Fibre helps to keep the bowel movements regular, so you're not straining as much when you do a bowel movement. Tip number 2, stay hydrated. Drink plenty of water throughout the day. Aim for at least 8 glasses of water per day. Sufficient hydration helps to keep the stool soft and prevent constipation. Tip number 3, exercise regularly. Engage in physical activity to improve circulation and stimulate bowel movements. Aim for at least 30 minutes of moderate exercise most days of the week. Tip number 4, avoid straining during bowel movements. Don't force or strain during bowel movements. Take your time and allow the body to naturally eliminate waste. Tip number 5, correct seating position. Improve your sitting position by using a squat toilet or putting a stool under your feet. Tip number 6, practice proper hygiene. Clean the anal area gently after a bowel movement. Use moist toilet paper, unscented wipes or a bidet for cleaning. Avoid using dry or scented toilet paper as this can irritate the area. Tip number 7, avoid prolonged sitting or standing. Take breaks from prolonged sitting or standing to avoid added pressure onto the rectal area. Lift heavy objects with caution. If you need to lift heavy objects, make sure you use a proper lifting technique to avoid straining. Tip number 9, avoid tight clothing. Wear loose-fitting clothes to prevent constriction around the waist and the anal area. Tip number 10, don't delay bathroom trips. When you feel the urge to have a bowel movement, make sure you go. Delaying can lead to harder stools and increased strain. Let's go through some commonly asked questions regarding hemorrhoids. What can I use safely in pregnancy? Most of the over-the-counter treatments for hemorrhoids are considered safe in pregnancy. What should I do if they don't go away? If it's been more than a week and they don't go away, make sure you speak to your doctor. There are also prescription treatments, and in more severe cases you may need surgery. How do I know if I've got a hemorrhoid or an anal fissure? An anal fissure is a tear in the lining in the anus. The symptoms can be very similar, but the main difference is with hemorrhoids you tend to feel the pain throughout the whole day. With an anal fissure you usually feel the pain during a bowel motion. If you're unsure, make sure you see the doctor. So that's all for today for our video on hemorrhoids. If you like anything in this video and want to see more, make sure to subscribe. Thanks for watching, and we'll see you next time. Bye!